Has Sweden gone off the deep end, or is it ahead of the curve in its approach to the coronavirus pandemic? It's become the subject of enormous debate as the Scandinavian country of 10 million goes a very different way than most every other country in dealing with the crisis. Social distancing there is encouraged. No gatherings of more than 50 are allowed. High schools and universities are closed and doing remote learning, and no visitors are allowed at nursing homes. But things are still dramatically different in Sweden than here. Children through 8th grade are still in school, restaurants and bars are open, so are stores, workout facilities, and many offices. If people can work at home, they're encouraged to, but there's no blanket shutdown of any sector there, and hardly anyone is wearing a mask. Swedish health authorities say they're striking a reasonable middle ground that protects health while not shutting down their economy. There's also talk that they will achieve before other countries something called herd immunity, where enough people have been infected with the virus to slow or stop its spread. In the meantime, though, Sweden is experiencing much higher coronavirus death rates than their Scandinavian neighbors. But will it still look like that in 6 months or a year, with those countries now starting to open things up? Swedish leaders say this is a marathon, not a sprint, and their approach is one that can be sustained over the long haul. I'm Michael Jonas from CommonWealth Magazine. The podcast is going far afield from our usual Massachusetts focus. Later, we'll talk with someone in Sweden about life there. But first, we wanted to get a better understanding of all this from a science and public health perspective.
It does appear to be a gamble. You could argue it's an experiment. I think it's interesting for the rest of us to look and see what happens. I'm not sure I would really like to be a guinea pig, let's put it that way.
That's Helen Jenkins. She's an assistant professor of biostatistics at the Boston University School of Public Health, and she's not at all convinced that Sweden is going down the right road.
They've certainly taken, let's say, a slightly more relaxed strategy than some other places. But I know in some places it's been described as not doing anything or not having any restrictions, and that's definitely not true. They've had some restrictions. For example, they're not allowing gatherings of over 50 people. My understanding is that older children, maybe adolescents, and college age or university age people are not going to school. Those have been closed. And of course, there's been a lot of voluntary participation in terms of people working from home a lot more, not traveling maybe to second homes unless it's deemed essential. So quite a lot has been done there. So while it's more relaxed, there have definitely been various restrictions in place. And as I say, on the voluntary side as well.
And yet it's been characterized really as an outlier in terms of what countries are doing. I mean, they have not done sort of this full lockdown that we and many other countries have done. The restaurants are open. As you say, grade school kids are still going to school. People are out at parks and in smaller gatherings. I mean, I've heard I think the deputy prime minister interviewed this week, who said that, one way to think of it is that they're viewing this whole pandemic as much more of a marathon than a sprint. And so they're trying to sort of develop an approach that can be sustained over, months, maybe for the next year, or who knows, until, a vaccine is developed or something. And that they think that this approach is sort of more sustainable. We are in this lockdown, which everybody's sort of anxious to know when it will end. And then there's sort of a question of, well, then what's going to happen? So how does that sort of metaphor of sort of the marathon versus the sprint strike you?
I think it's absolutely right. I think it's wise to think about this in terms of a marathon because it's not that this is just going to be over in the next few weeks or by the start of the summer at all. And we definitely shouldn't be thinking about it in those terms. Several places have done much stronger lockdowns, partly because they absolutely had to. When you saw what happened in northern Italy, they had to take the strongest intervention they possibly could. And when you look at what's happened in New York, the same thing. And so many places have done very strong lockdowns, either because they didn't have any choice or they wanted to be really sure that they weren't going to experience what those places have unfortunately experienced. But I completely agree that this is not sustainable. and we are going to have to relax restrictions at some point. The main goal was to protect healthcare systems. We are going to have to relax things, and it's definitely worth looking at Sweden to see what they have done, and what might be a feasible way to start to relax restrictions in parts of the United States, for example.
And yet, and I know that sort of when and where you slice the data, can sort of tell different stories. At this point in time, the data suggests that or show that they've got a COVID-19 death rate that's just much higher than their neighbors. It's sort of 3 to 5 times that of Denmark, Norway, Finland at this point. And so, what does that say to you?
Obviously, it's incredibly sad. The other thing which I think is worth pointing out is that many places, including Sweden, have talked about protecting the older population. And it appears that whatever they have tried to do that hasn't worked as well as you might like it to. I've seen reports of a third or even 50% of their deaths have been in care homes, for example.
Right, which we've had here in Massachusetts, just here, over 50% of our deaths, I believe, at this point.
Yeah, it's horrific. I also think that, so on one side, I would say this pandemic, as we've discussed, is a marathon. It's not over. And although the death rates are definitely higher in Sweden than in comparable countries, I think it's important to remember that we might want to look at those numbers again in 6 months or a year's time and see how things have played out over the longer term. But again, coming back, kind of arguing on the other side, I would say that there's a lot of value in trying to hold off and slow transmission as much as we can. We're learning so much more about this virus over time. We're learning about how to treat people better. And, just the other day, we had results coming out from a couple of studies looking at remdesivir and how that seems to lower mortality and help people recover more quickly. So I think there's a lot of value in slowing transmission and not taking a more fatalistic attitude, so that we can learn more about treatments and hopefully treat people better over the coming months, and hopefully lower death rates, obviously.
Well, that seems like a really important point because, again, I've seen some of the Swedish authorities have said that they are that other countries are going to experience sort of the same sort of burden of this disease. It's just going to be stretched out over a longer period. I mean, they're not quite saying it that way, that they're sort of getting it over with. But you're suggesting that that there could be some danger, or that there's sort of more risk in that, and that there's a real case for doing all you can to put things off because the situation could be different.
Yes, as I say, I think it's a slightly fatalistic attitude. I think that if we can slow things, we can learn about what treatments might work. There's also, of course, the argument of protecting healthcare workers. In some countries, and many healthcare workers have died. And another thing that we're learning about all the time is how to best protect those healthcare workers. So if we give ourselves more time and slow transmission, we can obtain more PPE, we can learn more about the best ways to protect those healthcare workers. So I think there are lots of advantages to just giving ourselves time to learn more, and be able to save more lives that way.
And yet, as you say, we're going to have to sort of ease back on things. And is there some danger that, as we do that, just as they're saying that some of the neighbors of Sweden that have had much lower rates are beginning to ease back, and I think the Swedish officials are saying, well, we're going to start to see their cases start to move up as well.
We might see their cases move up. And this gets back to a point which I think epidemiologists have been saying for a long time, is that we need really good testing. Once you start to relax restrictions, you need to have really good testing in place so that if the numbers do start to tick up, you can possibly tighten up those restrictions a little bit again to try and keep that reproductive number maybe somewhere around 1. Also, I think it's worth noting that countries, for example, Denmark has been allowing younger kids to come back to school. they're not just going back to how things were before. They're doing all sorts of things to try and minimize transmission. They're trying to actually keep kids a couple of meters apart from each other, which seems like a very difficult task, but they're actually trying to do that. I believe that parents are not meant to come into the school. I think that I've heard discussions of things like staggered recess time so that kids aren't mixing with each other too much. So, yeah, it'll be interesting to see what happens, but it's not that they're just going straight back to normal.
Right. And then just lastly, with regard to Sweden, again, there's been sort of discussion and even sort of dispute over whether the strategy involves this idea of trying to achieve herd immunity, where there's enough people who've been infected to sort of slow or basically stop the transmission. And is that, I mean, do you think that's sort of part of what's going on there, and is that a viable, reasonable approach to take with this virus?
So I think looking at the long term, the only way this is going to end is through achieving a level of population immunity. I think that's true. Now, obviously, the hope is that a good vaccine will be developed and we can achieve population immunity by vaccinating lots of people, which is obviously a much safer way of achieving that goal. Um, we don't know for certain if a good vaccine can be developed, so we certainly shouldn't be entirely relying on that. So then it may be that we're going to have to achieve population immunity just through people getting infected. But again, as I said before, I think there's a lot of value in slowing that process down so that people can get infected and survive, and we can minimize those deaths as much as possible.
So how does all this feel on the ground in Sweden? Hanna Radomski is a 40-year-old psychotherapist who lives in the southern Swedish city of Malmö with her husband and two young sons. Oh, and one other thing. She's my cousin. Hello, Hanna.
Hi, Michael.
How are you doing?
I'm fine. I'm very fine. It's a Swedish holiday, so work is off and schools are closed today.
Uh-huh. So everyone in the States is very interested in what's going on in Sweden. We've seen a lot written about it, and we're hearing a lot about Sweden taking this very different approach to the pandemic than almost any other country. Certainly different than here, where we're all sort of still in Massachusetts, at least, sort of in this lockdown mode.
Yeah.
So what's it been like for you? What's your day like there? What's life like?
It's certainly different in some ways, but also in a strange way, kind of normal, because I still go to my work. My husband works from home because they suggest if you can work from home that you do it, and he can do it. But I, as I'm seeing patients, I go to work, and most patients actually come for physical meetings. Some of them who are like in certain risk groups, as they say in Sweden, they stay home, and we have like Zoom or Skype meetings instead. My colleagues are also there, and what we have done is like we try to clean more, like several times a day, and we have, of course, information on the door and everything, like don't come here if you feel sick. But that the work is still kind of normal, and my kids, they still go to school.
Right, and they're how old now? Almost turned 11 just the other day, right?
And the other one is 8.
And Edgar is 8. And so the schools are still in session, going up to like everything up until high school, right?
Yeah, sure. So their school, they have made some changes in school. For instance, they don't have how do you say, physical activities. They have it like only outside, so they don't go in the locker rooms and change and all that, because then they are, yeah. But they still sit together in the classroom like normally. But I know that they try to have more class outside, and all the breaks, of course, and everything. So everything is more outside, but the kids are still playing. I would say kind of normal.
Yeah, right.
Yeah.
And like restaurants are open, bars are open, all the stores are open, right?
Yes. what's different in stores, for instance, is that they have put signs on the ground, like, every second meter, like, and everywhere is a lot of signs like keep distance, don't come in here if you have any symptoms of cold or cough or fever. And they like, how do you say, uh, they like, how do you say, the authorities say they advise us to keep distance.
Right.
And also in the restaurants they have done some small changes, that for instance you can't hang in the bar, you can only have like seated service, and also they have more distance between tables. So like more distance but still open.
Right. And have you been out to restaurants in the last few weeks?
I have been out for a lunch. I have not been out as much as usually, and also we have ordered like takeaway, also because we want to support the restaurants because they are losing people. I mean, there are fewer people out, but there are still people out having, eating and drinking and so on.
Right, right. And and the sort of streets are still, crowded with people, and people are hanging out.
Yeah, not as much. I mean, you certainly see a difference in the city. In this also, if I want to go, if I need something in a normal store, it's open, but there are fewer people, I would say, and so not as much people hanging out, but still, I mean, like today, it's normally, since it's the worker holiday, 1st of May, it would be big demonstrations and like meetings in the park and politicians giving speech and all of that. Of course, all of those big gatherings are cancelled. In Sweden, they have this that no more people than 50 could be together. So also, if, for instance, where I go for like workout, I have there are still classes like inside in the gym, like aerobics and this kind of stuff, but they have fewer attendants, so only maximum 50, and most places have like 30 or 20 in every group. And also, I personally, I don't go inside, but I go like for outdoor cross training and stuff, and then we are maybe like 30 people, but outside, but still, I mean, more or less together, but with distance, but together in a way.
Right, right. I remember you all telling us once there was like a particular Swedish word that sort of describes sort of the Swedish mindset that, is kind of a not too much this way, not too much that way. Do you know what I'm talking about? What's the word?
Lagom.
Right. And do you think that kind of captures in a way kind of how you're approaching it?
Yes, yes, I would say that, like, everybody is like, well, you mean that people are making changes, but and also I would say in Sweden we have different policy for different age groups. So for instance, the ones that are 70 plus, 70 and up, so they are advised not to go to stores, not to go to the gym, not to go to restaurants at all. So the ones that are older are really like strongly advised to keep bigger distance than the rest of us. And also, if you belong to a certain risk group, like overweight or asthma or heart conditions and so on. But I think it's like the Swedish way is that if we get people to do this, like you said, lagom, like a little, do changes, but not too hard changes, then people will keep doing it.
And that's sort of what they say has been the idea that, first of all, that there's been a lot of cooperation, we hear, with these kind of advisories, and that also, like the health authorities are saying that that we need to, or that they feel like what they need to do is come up with an approach and policies that people can stay with for like months or maybe the next year, or we just don't really know.
Yeah, and also that they don't want. I think that Sweden has also a very good like child perspective, that it's not good for the kids to have to stay home with their parents all the time, especially if the parents have to work from home. So that the kids should have like normal as possible. And also, I mean, we have in Sweden, free school food and all of that. So I think that is also a very good plan, that the kids can have a kind of a normal life. Because when I was telling my kids, now I was doing this interview with you, and they were like, and what are you going to talk about? I was like, yeah, how it's for us here. And also we listened to the Swedish prime minister had his 1st of May speech, and he said that we all have to like keep up this social distancing, and we have to keep up this how to say, to make this adjustments, that we have to, that it's harder for everyone, especially for the older ones, or those who have older family members that they can't spend as much time with, or those who lives in elderly homes, like they can't go in and visit them. It's not allowed to visit anymore. So there are sacrifices for everyone, but for the kids, it's not so much. It's like their normal activities are closed, like the things they do in after school time. Though most of them are closed, but football, soccer, all of that outside activities are still on. So
Right. And so your kids didn't even have a sense that, oh, you'd be talking about this topic, because it's not like something that is sort of are people talking about it constantly, or are your kids very aware?
They are aware, and like if someone is like doing like this, then everybody is like joking, oh, corona, stay away. So it's really that message from the authorities that if you have any small symptoms, don't go outside. And I think everybody had learned that. So it's like they know, like if they sneeze, then they are like, no, then I have to be home. It's so they know about it, but they are not. I wouldn't say they are afraid. My kids are not afraid or worried at all.
And do people wear masks at all when they're outside or in public?
There are some, but I talked to my nephew who just came back from the States, and he was like shocked that it's so little here in Sweden compared to the United States. It's maybe I don't know, one in every, I don't know, how 20 I meet or something like that. Yeah.
Oh, really? Yeah. So it's very not common at all. Almost nobody. Yeah.
And in the stores, people are not having, I mean, the ones working in the stores do not have masks. So they have like put up in the stores, they have put up in some places these kind of like glass shields between the customer and the shop attendant. But that's the only thing, really.
And so how are you feeling about it? I mean, you're obviously aware of this attention to Sweden and all the discussion about whether the Sweden sort of has got sort of the right approach that will sort of be sustainable, or is it a big gamble? I talked to a public health expert here who was saying she does think it's sort of like a gamble, or it's kind of an experiment that Sweden is the guinea pig for.
I think I really think, and I think most of my friends and people I meet, I think almost all of us here think this is the best, really, because we see our neighbor countries, they closed down more hard than Sweden, but now they're opening up. So I think this is because no society can handle this, like for in the long run, that you can't go outside, that everything is closed. It will be a total disaster. So I also think it's really like taboo. Like no one would go outside or go to work if they had any symptoms. I mean, that would be really. How to say it, we have like a strong conscience like that you shouldn't do. I mean, I don't think anyone go, but I don't go in public transportation because I go by bike. But some colleague of mine who go with the train every day, she says that she can sometimes see people like having symptoms and still be on the train, but then it's like it's a thing. He's like, should I report this to someone, or should I talk to them? Or it's based much on like the own individual responsibility.
Right. But as they say here, even though you can be very scrupulous about not going out if you're not feeling well, there's this whole idea that there are, a lot of people who could be infected but without any symptoms. So that's sort of out there. And also, I was just going to say the neighboring countries, as we keep seeing the data, their rate of coronavirus deaths is much lower, per capita. And so, that's sort of the comparison now. Some people say that will change. And even the public health expert I talked to said, we really we're going to need to look back a year or two from now and look at all the data then. That's really the only time we're going to be able to fully understand, these different approaches.
Yeah, because what I mean, I'm certainly not an expert in this, but what our authorities keep, I mean, what I read from them at least, is that if you close down too hard, like some of our countries, then maybe they will have like a second wave. I mean, it will come anyway, but sooner or later. So, and I don't know. I think, I mean, what everyone really try to do is like, people are still like, we and some other people we know, that we still meet other people, but we try to do it very as safe as possible, like do it outside, taking, also I have my older mother, not very old but 70, so we meet her every week. Yeah, but we meet with her, but we only meet her outside. So we take walks and having picnics, and then she sit like, I mean, we are together but not close together, and she's not hugging her grandchildren and so on. And I mean, so there is a lot of talking about like helping others do their shopping and helping olders doing errands. And I would say that it's, yeah, I would say that we try to do it safe, but still continue living in a way.
Yeah. And do you think most people so you're saying most people feel pretty positive about the approach, and they're not sort of in a sort of sense, there's not a sense of panic that, oh my God, Sweden is.
Not in my group, so to speak. I mean, I know that there have been, it has been shifting with our public health agencies. I mean, sometimes when they have this, like every day they have this press conference, and I have heard that sometimes they have been getting like a lot of in social media, like, oh, they are bad, and why don't they do it harder, why don't you close down harder, and so on. But I don't think it is as much as before. I think that people are kind of, yeah, in a way, kind of content with this.
Right, right. And so in that way, do you think there's a sense that they feel that Sweden maybe got it right, and these other countries everywhere else, we've had enormous, impacts on our economy and people out of work and all that, and you feel like maybe Sweden has sort of gotten it right here?
I hope to think so, at least. I mean, yeah, I think so. I mean, we will not know, but you have, even if you're, I mean, the countries who are closing down super hard, they have even more death. I mean, like you and Spain and Italy and France, and I just can't imagine having to stay home, like in quarantine with my kids, if they are not having any symptoms, and trying to work from home, and they should like climb the walls. And yeah, I mean, it would be torture for everyone. um so I'm very happy that we are allowed to be outside, even if it's not, they say like we can't have big parties, you can't have, you know weddings and all of this. but I think, so for the older it's the hardest, I would say, because they have the, I mean, they have even harder time, not, but still, like when we talk, we have family also in France, for instance, and when we talk to her, she's allowed to go out 1 hour a day, only, like, I don't know, 100 meters from her house. And then my mother, she can't go shopping, but she can take walks and having coffee outside with her friends, like she do that every day. So she keeps saying, she doesn't go inside. No, she doesn't go inside. So she doesn't go inside, but she still is very social and also very active. So, like, taking care of her health. She has never been in a more fit way than now, because she's walking like, 20,000 steps a day or something. So I think it's also good if they catch the virus, then it's better if everyone is in a good condition.
Right. That's probably true too. Absolutely. And I know though that yesterday was a big was a holiday, a different holiday. What was that? What is that holiday called?
In English, I don't know. It's
Or just
called,
in Swedish?
in Swedish, it's called Valborg. it's like you celebrate the end, the last day of April. So it's like you normally people gather like in big outside in the countryside or in parks, and you have like a very big fire, and then you have like like a bonfire, like a very big bonfire, and then you have certain songs for like welcoming spring and summertime. So that's something. No, no. I mean, all the official ways, all the official fires and everything, of course, were closed. So I mean, people, and then it also became very rainy, so the authorities were happy. Because it's also a day when the young kids, like in like the students in college and university, usually meet in parks and
Right. And the colleges are all closed now, right?
yeah. So they are closed, but they have like this online studying. But they still hang out. They still meet. So they wanted to avoid like nice weather, crowds of kids having parties in the parks.
And so, even though I know that everybody's saying that the Swedish people are very, conscientious and listening to the recommendations, there was these articles reporting how in Lund, where you were, just near you, a big university town, they were worried about the college students all gathering for big parties, so they spread chicken manure, I read, on the main town park, which would probably keep people away, I guess.
Yeah, and also they put fences up, and also it was heavy raining, so it was like check on everything. But because it has been, the last weeks have been really like sunny and warm here, so then they really got out gone out how do you say, they gone out and warned us like, even if it's sunny, even if it's nice weather, that doesn't mean that you can keep, you have to still keep distancing. You can meet outside, but you have to have the distance, and you shouldn't meet in big groups, even if it's like really big groups, even if it's outside. So they try to like remind us that, okay, don't forget about everything because it's sunny outside. Yeah.
Right. All right. Well, it's been great to help us understand how life is there and how people are feeling about it. And of course, we wish well for everyone. So
Yeah.
stay
Yeah.
healthy, stay
Yeah,
well.
you too. You too.
And it's really, everyone keeps saying what an unusual time we're in. And so I think also unusual is I don't think I ever have ended a podcast this way, but love to everyone there from me.
Yeah, thanks. And to you too. Bye bye.